Good evening. We are getting started shortly with our program this evening. And I want to thank you all for being here and joining us tonight with our conversation, giving us just a few more minutes to get started. All right. Good evening, everybody. Good evening, good evening, good evening. So I do want to welcome you all to tonight's DREF Research Matters for All of Us Citywide Coordinator position. Tonight, we're going to talk about community engagement in aging research, which is really, really important as DREF, is really working hard at increasing awareness and encouraging enrollment in NIH's All of Us Research Program, which is a national effort. So if you've joined me before, you know that before we really get started in our engaging presentation, I do tell you a little bit more about DREF's work and the All of Us research program. So what I'm going to do is I'm going to take myself off video and we'll start the presentation. So good evening and thank you again for joining us. And, we're going to talk about the DREF involvement in the Research Matters for All of Us program. And you learn about some valuable information about how this work is attempting to decrease health disparities. And this is really, really important because as we're looking at health equity, increasing African American participation in research is invaluable. So again, I'm Kelly Britton, the citywide coordinator for Detroit. And let me tell you a little bit about DREF if you're not familiar. DREF stands for the Delta Research and Educational Foundation. It was established in 1967. It is a 501c3 nonprofit organization focused on supporting African American women and their families. Now, the objective of the DREF Research Matters for All of Us initiative is to create awareness in the African American community about the NIH All of Us research program, as well as share about the importance in participating in biomedical research broadly, but just research in general. As the citywide coordinator, I'm responsible for conducting ongoing virtual and in-person events or programs to educate our community about the importance of biomedical research and research in general. On this slide, DREF is one of the national engagement partners assisting NIH All of Us research program to improve health for generations to come. So on this slide, you'll see the executive board members of DREF, office staff, and other staff of the DREF Research Matters for All of Us program. So I don't know if you knew, and I'm gonna go back, is that there's actually 12 cities across the United States with citywide coordinators from DREF. And those cities include Atlanta, Baton Rouge, Boston, Chicago, Denver, Detroit, Houston, Miami, Milwaukee, New Orleans, New York, and Shreveport. But tonight, our focus is on the D. So, our participation in the Research Matters for All of Us campaign, our goals are to, like I said before, create awareness regarding the importance of being involved in the All of Us research program. We're also encouraging health and wellness and really bringing forward topics that are important to the African American community. When we're thinking about the importance of the All of Us research program, we have to go back and remember that in the Obama administration, former director of the NIH, Dr. Francis Collins, and folks in the Obama administration created the Precision Medicine Initiative. So let's hear from Dr. Collins and others about why this program is needed and how diversity in research will make an impact in our community.
So much of what we've done in medicine over the years has not really taken into account individual differences. And this is an opportunity to be part of something historic.
Most studies and most clinical trials have always been with the average white male. So as we start thinking about this in the context of building trust, I think we get back that trust by involving the community, not saying you come to us or we'll just do things to you. We're going to do things with you and in fact allow that information to be accessible to you, the individual.
You're going to have some individuals that are going to say, yes, good, we're getting in on the ground level of a study. And then you're going to have those that have some trepidations about it. My thing is to bring them aboard and let them know that this is for the greater good for them. We have input and, without input, there's no buy-in. And without buy-in, there's no commitment. Without commitment, there's no success.
Tuskegee happened. We're not trying to hide that or sweep it under the rug, but communities of color will be at a disadvantage if we do not find ways to get by that, whether the focus is asthma, whether the focus is infant mortality, whether the focus is diabetes, cancer, or heart disease. Communities of color are disproportionately impacted by them.
It has always been playing catch up to make sure that they're even getting access, much less minimum service. Low income, underserved, and people of color are oftentimes very generous in giving something if they understand it. And they always do so with the intention that knowing this is not just about me, this is not just even about my family, it is about helping the community down the road.
Being able to bring the Asian American population who is never at the table, not only to contribute to science, but to contribute to our ability to understand the nuances within those populations. I think it will provide a huge national data set so we can ask questions and make discoveries about healthcare that will better their own personal health and those of the communities that they are part of.
Diversity strengthens the science. It could bridge some civil rights issues and inequities in healthcare across all races and ethnicities and culture.
As a community of color, underrepresented, hidden, underserved, what would happen if you were not at the table? It is an issue of equity and it's an issue of justice as well.
It is important for minorities to be a part of this, or we will again be left with medications that are created for really other populations. I'm hopeful that we will be overwhelmed with folk.
So again, let's see, the All of Us research program is governed by the National Institutes of Health. It's really a huge undertaking because the goal is to gather data from 1 million or more people living in the United States to accelerate research and improve health. And it takes into account individual differences in an effort to deliver precision medicine. Another aim is to improve the health of our loved ones and their health outcomes. We're really hoping that by engaging 1 million diverse people that we can decrease health disparities. It is a catalyst that will fuel a new approach to individualized prevention and treatment called precision medicine. So let's hear from President Obama.
Something called precision medicine, in some cases people call it personalized medicine, gives us one of the greatest opportunities for new medical breakthroughs that we have ever seen. Doctors have always recognized that every patient is unique. And doctors have always tried to tailor their treatments as best they can to individuals. You can match a blood transfusion to a blood type. That was an important discovery. What if matching a cancer cure to our genetic code was just as easy, just as standard? What if figuring out the right dose of medicine was as simple as taking our temperature? And that's the promise of precision medicine, delivering the right treatments at the right time, every time, to the right person.
So after listening to President Obama, I hope you really understand that precision medicine is pretty important, and it is important to helping us create new advances in medicine. And to answer President Obama's call, the NIH created the All of Us Research program, which is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. The program will do this by nurturing relationships with diverse populations, fueling a robust community of researchers, and establishing one of the largest and richly diverse resources for biomedical research. So the core values that the program embraces is that participation is open to all, that participants reflect a rich diversity of the United States, participants are partners, trust will be earned through transparency, participants will have access to their information, data will be accessed broadly for research purposes, security and privacy will be of highest importance, and the program will be a catalyst for positive change in research. Now, if you get involved with the All of Us Research program, which I'm a part of it, I've enrolled and everything, you actually get to decide how much or how little you want to participate, right? So you got to go on and create an online account. Once the account is created, there's this interactive online consent process that involves watching some videos. And then the intent is to ensure that all potential participants fully understand all aspects of the program. Now, once you have given your consent and you fully understand everything, well, I should say fully understand everything and then give your consent to participate, then you're allowed to join the program. And there are some basic initial surveys that you're asked to complete: medical history, information, family history, lifestyle. And then from there, you can kind of decide how much information you want to provide and how much you want to participate. Some folks engage in biometric research by wearing Fitbits or other types of things. Other people are asked to come in and give biologic samples, blood, saliva. Some people choose to engage in providing physical measurements or even taking surveys. The thing that most folks need to remember is that you can withdraw from participating at any time. And so we're really hoping that some of these questions on the slide will be answered by the participants and researchers working in the All of Us Research program.
The All of Us Research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
So really, you know, the promise for participants, what do you get out of your participation? You know, you will know that your efforts will help in combating disease for us now and in future generations. It does also offer you an opportunity to learn about your own health because you get all your information back in terms of health status and biometric information. So you get your own results. You can access your own data. You also have the opportunity to learn about additional research projects that you may want to be a part of. And you can visit all of us, research allofus.org to learn more. Fortunately, in the Detroit area, we have a local healthcare provider organization where you can just kind of walk in and sign up for all of us, fill out the surveys, as well as give your biomedical specimens. And our healthcare provider organization in Detroit is Henry Ford. And on the slide, you can see there are 4 locations that you can go walk into and join the All of Us program. And again, at any of those sites, you can go in, create an account, give your consent. You can agree or not to share your electronic health records and answer surveys. And then when you're done, you'll receive a $25 gift card. And they're hoping to open the site up in Brownstown soon. So here is more information about how to join All of Us through Henry Ford, through their project. I'll share information on how you can join All of Us through DREF. And here is a QR code I was just kind of talking about how you can get more information and how you can give some feedback on tonight's presentation. And I'll put some information in the chat box about how to join DREF, how to join All of Us through the DREF link. And you can follow us on social media. So again, here's my contact information. If you want to reach out to me and ask me to come and do a presentation, or you want more information about All of Us, feel free to contact me. So we're about to transition to what I consider one of the best parts of the program, which is where we get a chance to hear from a researcher engaged in research among African Americans, which I think is really important that we share this information. Before this, though, I got to read a disclaimer. The views and opinions expressed by our guest panelists and/or presenters do not reflect the views or opinions of the Delta Research and Educational Foundation, DREF, or DREF Research Matters for All of Us, the NIH All of Us Research Program, or any of these organizations' affiliates. Now, it gives me just such great pleasure to introduce Dr. Sneed. Dr. Sneed is an assistant professor jointly appointed in the Institute of Gerontology and the Department of Psychology at Wayne State University, my 2-time alma mater. She is a social gerontologist interested in how the social environment impacts adult developing and aging in diverse populations of mid and late life adults. She has expertise in biopsychosocial models of health, community engaged research, and chronic disease. Her work engages community and institutional stakeholders to identify and improve upon factors that contribute to inequities in health and well-being among mid and late life adults. Dr. Sneed is a Detroit native and was initiated into Rho Epsilon chapter of Delta Sigma Theta Sorority Incorporated at Princeton University. Go on, Soror. She earned a PhD in social and health psychology at Carnegie Mellon University, her master's of public health degree at Columbia, and a bachelor's arts degree from Princeton. So you know, our presenter has credentials, street cred, and community engagement, which is so important. So I'm going to stop sharing my screen and kick it over to Dr. Sneed. Dr. Sneed, you're on mute.
Thank you. Thank you so much, Kelly, for the wonderful introduction. I'm going to talk to you all briefly about some of the work that I do to engage community members in research and the ways in which community members can get involved in research. All right, and so like Kelly said, I do a lot of work that's really focused on mid and late life adults and helping to connect folks from this population to researchers in order to boost researchers' capacity to do work in communities and also community members' capacity to participate in research. So I'm at Wayne State. I'm fairly new to Wayne State. I've been at Wayne State since August. Previously, I was at Michigan State University in Flint for about 5 years. And so the work that I do happens in both Detroit and Flint, and I'm continuing work in both communities. And so I just want to tell you a little bit about the work that I do, and hopefully it'll stimulate some interest and some conversation. So like Kelly mentioned, I have a background in gerontology, so my research is always focused on older adults. I also have a public health background as well. So in addition to studying older adults, I also want to make improvements in older adult communities as well. And in particular, I'm really interested in thinking about how can we help older people age well, in spite of any sort of economic vulnerabilities that exist within the communities that they live. And so I do a lot of community engaged work focused on understanding the needs of older people and then translating those needs into action. So developing and adapting and improving upon interventions that can contribute to the health and well-being of older people. And so there are three main things that I want to do in the time that we have today. First, I want to just give a blanket definition of what I mean when I say community engaged research. There are a lot of different ways that people think about community engagement. So I'd like us to start with just one basic definition. And then after that, I want to talk a little bit about why community involvement in research, particularly aging research, matters. And then I want to end by just providing some examples of different ways that community members can get involved in doing aging research. All right, so first of all, what is community engaged research? What do we mean when we say community engagement? And so the definition that the Centers for Disease Control and Prevention uses is that community engaged research is the process of working collaboratively with groups of people affiliated by geographic proximity, special interest, or similar situations with respect to issues affecting their well-being. And so I want to pick apart this definition a little bit by emphasizing that we're talking about working collaboratively together. And that's not necessarily something that the average person thinks about when they think about research. Usually we think about researchers, our professors or academics or scientists of some kind, and they're coming in to do research on people. But that's not community engagement. That's not what all of us is about, and that's not what the work that I do is about either. We're really interested in working collaboratively with people. So rather than having research done on people, you want research done with people. And these people can be affiliated in a variety of ways. So sometimes we do research with people who live in the same area. Sometimes we do research with people who have some topic in common that brings them together. Or sometimes we do research with people who have similar life circumstances that impact their health and well-being in some kind of way. But the key point here is working collaboratively is really what distinguishes community engaged research from other types of research. The other thing that I really want to make sure we understand is that when we talk about community engagement, we're not just talking about participating in research. So a project isn't community engaged just because data is collected from community members. That's not enough to call something community engaged. Really, when we talk about community engagement, we're talking about some level of partnership. So one of my community members, when she talks about community engaged research, she says that we're not doing research about us without us. So community members are partners. They're involved in the process, and research isn't just happening to them. The other thing that we think about is that community engagement doesn't just mean that research is placed in communities. So it's not enough that you're collecting data from people at community sites. That doesn't make it community engaged. So going to a community clinic and collecting data is not community engagement. That's research that's just community placed. We're really talking about the engagement aspect when we're talking about research. And then finally, community engaged research is not what we call helicopter research. So if you think about a helicopter during a disaster, a helicopter flies in, drops off whatever needs to be dropped off, does whatever needs to happen, and then flies back out. And we often see that that happens with research as well. People come in, collect data on whatever topic they're interested in, and then they fly out and you never see them again. That's not community engaged research. Really, when we're talking about community engagement, we're talking about making long-term investments in communities and actually working with community members over time in order to affect change. So flying in and flying out really just doesn't cut it when we're talking about community engagement. So who participates in community engaged research? What kinds of collaborators might researchers have when we're talking about community engaged research, especially when we're talking about aging research? So I think about a lot of the people that I work with to do my community engaged research, and I have a variety of partners. Sometimes I work with senior centers that might be interested in implementing programming for the people that they serve, or assisted living facilities that might want to implement programming for their residents. Sometimes we work with local businesses as they're attempting to make their businesses more age-friendly and partnering with them to do that. Sometimes I work with local government. So if the city has a particular initiative focused on older people, connecting with the city in order to develop that programming is a form of community engagement. I do a lot of work with churches, in particular because older adults tend to have very high church attendance. And so you'll hear me talk a little bit more specifically about the work that I do with churches as a way of connecting to older people. Even law enforcement agencies can partner on community engaged research. I've done work with departments of corrections in order to think about justice system involvement and how that impacts older adults. And there are a lot of ways to work with these partners that are not traditional health partners, but who have an investment in older adults in some kind of way. And then, of course, we can partner with healthcare providers like hospitals and clinics to do research as well. One thing that I want to mention that's really important is that you don't have to be a part of an agency to participate in research. I've done research with community members, individual community members who've said, I care about a topic and I want to work with researchers to solve some kind of problem. So individual community members can participate in research as well. You don't have to be a part of an agency to do that. So now I want to shift a little bit and talk about why we care about engaging community members in aging research. Why should community members get involved? Why does this matter? Well, first of all, community engagement matters because we want to make sure that the research that we're doing actually reflects health issues that older people in communities care about. So we as researchers are always doing research. Research is crucial for us to keep our jobs, to stay engaged, and really many of us got into research because we were curious about a topic, or because we wanted to address some kind of real world problem. But sometimes that doesn't necessarily map on to community need. And so it's really important to have community members engaged to ensure that community need stays at the forefront. And so by getting involved as a community member, you can have input on the types of health initiatives that emerge within your community. And just to give you an example, so one of the things that Wayne State has done to partner with agencies within the city of Detroit is to periodically conduct community needs assessments. So in 2020 in particular, my colleagues in the School of Social Work partnered with the Area Agency on Aging to do a community needs assessment. So they did listening sessions with community members, both community members who were independent as well as those who were homebound. They did a community survey, and they also talked to service providers that provide support to older people to really understand what are the needs of this population. What do people not have access to that they need access to? And in looking at the report that the collaboration put together, they mentioned a number of areas of unmet need. So things like help with health insurance or concern, transportation, adult day services, having access to meals for older people, workshops for individuals providing support to older people were important, as well as programming related to chronic disease management. And so based on the findings from this report, the Area Agency on Aging uses this data to inform their strategic plan over the next few years. And so by getting involved in this work, older people have input into what actually happens into the community and the ways in which the long-term needs of community members are addressed. So this is a really important reason to get involved in aging research. I'll mention another research study that I worked on in Flint that was really focused on understanding the needs of older women in the community in particular. And in this study, it was a qualitative research study where community members were interviewed and asked about their needs. And in particular, I want to talk about some of the needs that people articulated related to the needs of older women in the city of Flint. And so as part of this project, community members were very much leading the charge on this project. They helped to develop the study. They helped to develop the interview questions for the project. They recruited other women in the community, and they took the data from the interviews to make decisions about programs that needed to happen in the future to support older women in the community. And here are a few of the things that we observed from the interviews conducted with local women. First, older women told us that they wanted to engage with younger women in the community. And doing this was even more important to them than engaging in activities that are traditionally designed for seniors. So they didn't want to go to community centers and play bridge or do things like that. What they really wanted to do was to be able to give back in some way and share the things that they had learned in life with other people. So this was a point that many of the participants brought up during interviews about the ways in which they would like to spend their time as older people in the community. Another theme related to that is that older women talk specifically about wanting to use their experience as parents to support younger women. So a lot of younger women who were having children for the first time didn't really know a lot about what goes into caring for children or sort of dealing with issues that they might experience during the postpartum period. And older women felt as though they could offer that kind of support. And so there was a real interest in coming up with concrete ways in which older women could support younger women in the community. Another important theme that emerged from this work is that although older women had the desire to engage in intergenerational relationships, they felt as though they really needed formal programming in order to do this. So it was difficult for them to just go and initiate relationships with younger people. And so there was a thought that formal programs really could help to bridge the generational gap and connect older women to younger women in the community. And so several participants in this study told us about the importance of putting together programs and mentioned other programs throughout the state that did this kind of work that they wanted implemented in their own community. Another thing that people told us is that older women in the community experience stress in caring for multiple generations. So many women reported that they were taking care of grandchildren or even great-grandchildren. And being a caregiver for grandchildren often started in one's 40s. Additionally, people talked to us about the fact that they were sort of in a sandwich generation where they were caring for not only their grandchildren, but also caring for their older parents as well, and that they were experiencing stress as a result of that. Additionally, interview respondents talked about caring for family members who had significant trauma including mental health issues, PTSD, medical issues, and histories of sexual violence that really impacted their ability to function within their families. And then finally, people in the study talked to us a lot about how high community unemployment really impacted older people in the community. And so what we observe is that people talked about the fact that often the older person in the household might be supporting multiple generations because they were the only person in the household who had stable employment. And so that meant they had to delay retirement and all of the experiences that they hoped to have when they were older people, because they were trying to take care of a family. And so we collected this information, but it wasn't just about data collection. So as a part of the Flint Women's Study, the study included an executive board that made programming recommendations that we're in the process now of implementing. One, the executive board recommended that we do formal intergenerational programming to link older women to younger women. Secondly, there was really a call for caregiving programs that would specifically address the challenges of caring for multiple generations, especially while you were working or while you were in midlife. And then finally, the executive board called for programs specifically needed to address family trauma. And so I bring up this study and tell you about the results from it to give you some perspective on how community input really matters in shaping public health programming and research. And so by participating in this kind of work, either by participating as research participants or even helping to design a study like this, community voices can be heard. Another reason why it's really important for community members to get involved in aging research is to help researchers really understand how issues in the local community might influence health research and programming. So I'll tell you, I've done community engaged research in many different communities around the country. And there's one community in particular where we used to do a lot of door-to-door surveys. So we'd identify homes where older people lived, and we'd go and we'd talk to older adults about their needs. When I moved to a different community and suggested something like this, right away, residents told me that won't work here. You know, people aren't comfortable answering their doors to people that they don't know. People are concerned about scams. And so that's not going to work very well in this community. And so that was really beneficial to me as a researcher to know kind of what is the culture in this community and how can I get community input to ensure that the way I'm trying to do research is consistent with the culture and the values of this community. And so community members really play an important role here in helping researchers who may not be from the local community think about how to work through problems in a way that's consistent with the culture and values of that community. Another example I'll give you, and I'll reference this a few times during the presentation, is a project that I've worked on that's a faith-based initiative that was designed to engage 20 churches in the area in programming that would improve blood pressure outcomes among older people within congregations. And as a part of this project, our academic partners worked with a faith-based community center to implement physical activity and nutrition programming. So we organized fitness classes and peer support groups, and we taught people the DASH diet in order to help them to understand low sodium eating. We also did cooking demonstrations as well. And additionally, we helped churches to either organize health ministries if they didn't already have them, or to build the capacity of existing health ministries. Build the capacity of existing health ministries in order to support health within their churches. And so this work was done in the Flint community. And what we figured out pretty quickly is that we weren't able to do this work in the same way that we would have done it before the Flint water crisis. So the flood water crisis really changed a lot of the ways that researchers were able to work, and we weren't able to do research as usual. One, because the faith community was really taxed as a result of this water crisis. So faith leaders were engaged in a lot of activities, research and non-research, where they were really being called upon to provide support to the broader community. And so as a result, they had very little time for extra activities. And in some ways, our work was deemed to be extra when they were thinking about this sort of broader public health problem that was going on. And so in order to implement this church challenge health project that we wanted to do, we really had to pivot quite a bit. And so one of the first things that we did was talk to our community partners and say, how can we pull this off? What can we do to make it easier for churches to partner with us in this work? And so they gave us a lot of suggestions that we actually implemented. And one of the biggest things that they told us was that the churches needed help in managing their existing programs. They weren't able to take on anything else if they weren't able to sustain what they were already doing. And so a lot of the work that our team did initially was really focused on just helping faith leaders to do the work that they already do. So if they were doing anything health related already in the church, we supported that. Helping with food pantries, helping to organize a local health fair, doing water giveaways, whatever it was that they needed. We were there to do that with them. And so by helping to sort of take some of the load away from them, they were then able to commit time to the project that we were working on. And so I mentioned all of this just to drive home the point that we would not have known what to do had we not had a community partner that we were talking to regularly who could help us to quickly adjust our efforts and still meet our goals. And so community participation is really important when we're talking about trying to help researchers pivot when there are challenges in the local community. So when the local community faces situations that are not anticipated, community involvement really helps researchers to figure out how to solve the problem in a way that's conducive to what's happening already in the local community. Another reason that researchers really need to get involved with community members is to help recruit diverse populations into research. When we think about research, a lot of the research that's focused on older adults has primarily focused on white older adults without a lot of attention to more diverse populations. So that might be people with different ethnic backgrounds, racial backgrounds, nationalities, people of different sexual orientations and disabilities. A lot of the research on older adults doesn't include these populations, and that's a real problem. So just to give you an example, if we think about a disease like dementia, we know that Black Americans and Hispanics are overrepresented when we talk about prevalent dementia. So Black Americans are twice as likely to get dementia than whites, and Hispanics are 1.5 times more likely to get dementia than whites. However, if we think about who actually participates in research, Black Americans and Hispanics make up less than 10% of people that are currently enrolled in research. This matters. This, in particular, when we're talking about Alzheimer's, is a disease that disproportionately impacts Black and Brown communities, yet Black and Brown people are not enrolled in research. So any breakthroughs that emerge related to dementia, we don't know if they generalize to Black and Hispanic communities because Blacks and Hispanics have not been involved in the research. And so when the research doesn't reflect the people who actually get the disease, we have a problem. We have a major problem. And so it's really important for community members to get involved in research so that we can think about barriers to participation that really limit how much involvement we have from diverse populations. And community engagement can really help with that. So another reason that community members really should get involved in research is because community members can really provide insight on how to recruit and how to retain older people in research. So I'll give you a personal example of mine. So I was working on a study that was focused on heart health among older people. And we were doing a fairly good job of recruiting older people, but mostly people in their 70s were the ones signing up. We weren't getting people in their 50s or 60s to participate. And so I had a conversation with a community partner and said, what do we do? Why are we not getting other people to participate in this? And she took a look at our materials and said, your problem is that you're saying you're recruiting older adults. What kind of people do you want? How old do you want them to be? And I said, well, we want people over 50. And she said, well, then you need to say explicitly, we're recruiting people over 50, because people in their 50s and even their early 60s don't see themselves as older people. And she also told me, you're going about this all wrong. You can't just go to senior centers to recruit people if you want people in their 50s and 60s. They're still working. So you need to think beyond sort of these traditional models of what we think older people do and consider the fact that the people that you want are still very much engaged in community the same way as younger people. And that was really useful to me. And I wouldn't have had that information had I not consulted with my community partner in that recruitment process. And so that's a big reason why community involvement is really needed. Community members know their community. They know other people like them and how they think. And so by getting involved, they can really help us as researchers develop strategies that help us to recruit and retain people in research. Another reason that it's important for community members to get involved in research is that community members can really help us to ensure that the various components of our research studies are culturally appropriate. And so I mentioned before that as part of our faith-based initiative, we had cooking classes for the older people who participated. And from the very beginning, our community partners told us, people aren't going to care about these classes if you're not teaching them to cook food that they like. They don't want to learn new food, but they are okay with learning how to cook the food that they like in a healthier way. And so we purposely made a point of trying to find recipes that older African-American people would enjoy that were similar to the food that they already knew how to make. And the other thing that we did was really important in this study is that we had our community partners to sample all of the food that we put into our cooking classes. So if they said, hey, we don't like this, we didn't include it. And so really it's important to have community members involved in research to ensure that the way that you're trying to reach people will actually be appealing to them. And so in all of the work that we do, we're mindful of who the people are that are participating in our work and how we can tailor what we do by being mindful of their cultural practices. And so another reason that we really stress the importance of community involvement in aging research is that we really believe that establishing relationships is key for long-term change. So it's not enough to have sort of these transactional relationships with community members. It's really important for us to establish long-term partnerships in order to solve health problems. So I think about the partners that I work with. You know, I don't just work with them once and then we're done. We can work on new problems constantly because we've developed relationships. We have rapport, we have trust, and that can really translate into something that leads to long-term change. I think about the partners that I had before the pandemic. And when the pandemic came, it wasn't super difficult for us to pivot as partners because we already had those relationships with each other. So we may have been addressing a new problem, but we still had the same community in mind, and we still had the same basic understanding of the community and how to address issues within that community. And I think that really helped us to successfully pivot in ways that some researchers might not have been able to as well. So having this involvement is really important if you're trying to make sure that you're making long-lasting change in a community. So another important reason for community members to get involved in aging research is to ensure that individuals and communities are not harmed. So communities can be harmed by research in a lot of ways. One of the things that we found is after crises, that there would often be lots and lots of researchers coming into one particular community and asking for something. And so that places a burden on participants and partners. And so community members generally have a good sense of saying, hey, the community is not ready for this thing right now. This is not what the community needs. You're adding extra burden. And so community members can really sort of offer checks and balances to ensure that ultimately the communities where we do our work are not harmed by our work. Additionally, we think about the importance of community members in research because we know that sometimes the work that we do has the potential to reflect negatively on a community, insofar that it might reinforce negative stereotypes about a community. And so researchers often have sort of preconceived notions about groups of people that we really have to be mindful of and pay attention to blind spots that we might have. So if we think about stereotypes about older people, some people believe that it's inevitable that older people are just going to decline. And that's not true. Or some people think that older people are not capable of change. That's not necessarily true either. And so community members help us and constantly remind us about the potential for these stereotypes and really sort of help to steer researchers away from these kind of stereotypes as they're working with older people. And so community involvement is really important in making sure that we're sort of really thinking about what we're doing and not making assumptions about the people that we serve. All right, so I want to end by talking specifically about how community members can actually get involved. And there are lots of different ways for community members to participate in research. And so I want to talk about a range of different types of involvement. So one way that community members can be involved is right at the beginning of a project. Community members can actually be a part of designing research studies. And, from my perspective, I think this is a really great way for community members to be engaged. It sort of ensures that the research that's being developed is something that community members actually care about. So they may have a more vested interest in actually carrying out the project. So community members can partner with university faculty or other types of partners very early on to map out a project. And that's what we did with the Flint Women's Study. So our community partners came together and worked with our university partners to plan every phase of that study. Another way that community partners can get involved is by reviewing studies that have already been designed and giving feedback on them. And so I'll mention a couple of examples of that. First, at Wayne State, we have something called the Healthier Black Elders Center. And as a part of that center, we have a community advisory board. And members of that community advisory board are older people that live in the Metro Detroit area. And when researchers want to do research studies that include older people, they submit an application to the community advisory board. The board reviews the application, gives feedback on the proposal, and has a lot of conversation with the researchers about either ways to improve the proposal or to ensure that community voices are heard. And so that's a really important way for community members to actually have input and give feedback on research that's already been developed. In Flint, they have something similar as well. They have a community ethics review board that has sort of similar processes, but that group's work is not limited to older adults. So in that process, researchers submit a proposal and they actually go and give an oral presentation and do a Q&A with this community-led review board. And so this is a really nice opportunity for researchers to give feedback. So the board will tell researchers what they like or don't like about the proposal, give them suggestions on how to recruit people for the study. They may give suggestions on partners that they might want to consult with as they actually try to carry out the research study. And so it's a really valuable experience for researchers who have varying ranges of experience with community partner work to get perspectives from community members that really only help to improve the study ultimately. So this is one really nice way to get involved in research. Maybe if you're not interested in actually designing the project, at least giving feedback in a formal way. Another way that community members can get involved is by actually participating in the recruitment process. So for the faith-based research project that I mentioned earlier, we actually had community members to create a recruitment video. And so we were able to distribute this video to churches for them to play on Sunday mornings as a way of recruiting people for our work. So one of our pastors and one of our health team members were involved in the video and really sort of gave testimonials about the importance of participating in the project and about what they had actually gained from the work. And so this was a way for us to sort of have community involvement and have people connect with other people that they may already know in the community to kind of talk about the work that we were doing. Community members can also very much get involved with implementation of research. So I mentioned that I do a lot of intervention research, and that intervention research often includes community members as instructors of some kind. So we've trained community members to be fitness instructors who can then provide fitness instruction within the community. And some of the faith-based work that I do, we've trained health team members within churches to provide education. And this aspect of community engagement is really important because it really sort of helps with capacity building and ultimately sustainability of interventions. So after the researchers are gone and the data is collected and the money is all gone, you still have left something in the community that is a resource. And so this is a really nice way to sort of build capacity and promote sustainability, in particular when we're talking about intervention work. We've also gotten older adults involved in helping to collect data. So a lot of the volunteers that have worked with us have done human subjects research training so that they can actually consent people for research. They've learned how to collect data. They've learned how to take blood pressure or measure waist circumference. Or they've learned how to administer surveys. And again, all of this is building capacity such that, you know, if other research studies emerge, we're able to really have ongoing involvement from community members. So we've trained community members on how to interview people, how to code data, how to analyze data, which again boosts capacity for the work. We also try as much as possible to involve community members in actual dissemination of findings. So when we give oral presentations, our community partners go with us and co-present with us. Here's one of our community partners, for example, co-presented at the International Stroke Conference a couple months ago. And also when we were doing our COVID-19 research, our community partners helped us to do presentations in the community. So it wasn't just us talking at community, but there was also sort of bi-directional learning that happened as a result of us participating and disseminating our work. And in my research team, you know, we're very much committed to the fact that research data and findings should be shared back to community. And this is important for a number of reasons. First, people should have access to the knowledge that they made possible. And so as much as possible, when older people participate in our research, we try to give the information back to them. One of the biggest complaints that I do hear from participants about research is that some data was collected, but then we don't know what happened to it. No one ever said anything to us again. And so we really take pride in sharing findings back to community. First, just because we feel a sense of responsibility, and also because sharing the data back really helps us to think about how we can actually implement our findings immediately and locally. I'm of the mindset that research shouldn't be done for its own sake. And so if you're not doing research to solve a problem, you should really think about whether it's worth the time and the resources to collect data. And so as much as possible, we try to share data back so that we can act on it as quickly as possible. And so in our work, we try to disseminate our findings in a lot of ways. First, we make a point of disseminating our findings in both community and academic settings. So academics like to go to academic conferences, but we also make a point of having community town halls. We also make a point of having visual representations of our research that are easy to understand so that older people can actually understand what we found in our work. We also give joint oral presentations. So our community partners go with us to conferences and help us to present. Additionally, we have had community partners who co-author research papers with us. And that's a really nice collaborative experience that allows community partners to add their input on how findings are interpreted. And so you'll see these are just a couple examples of studies that we've done where both academic and community partners are named authors in journals that describe any of the findings that we have that come from our work. And so in summary, I want to leave you with a couple of thoughts. So first, in thinking about the definition of community engagement, we're really talking about that process of working collaboratively with people. So again, the work that I do is not just about collecting data, but really having an ongoing exchange of ideas and partnership with community residents and agencies. Second, again, just doing this work really is about collaboration. So we're not just enrolling participants in research, and we're not just going to community sites to collect data. It's really about that participation piece. And additionally, really getting involved in aging research is important because it really helps us to ensure that what the community members care about is actually addressed. It helps us to make sure that we're not harming communities in our work. And it's helping to make sure that all older adults get included. Older adults are not a monolith. There's a lot of diversity in the aging experience, and we want to make sure that we can capture that in our work. And then finally, hopefully you'll walk away from this knowing that there are lots of ways to get involved in aging research. So you can help to design studies. If you're doing intervention work, you can actually participate in implementing intervention. You can collect data. You can give feedback on existing studies. So there's no one right or wrong way to get involved, but involvement is important. And then I do just want to put in a plug, if for some reason people decide that they don't want to actively collaborate on research, there still is absolutely the opportunity to participate in research. Whether it's the All of Us program or at Wayne State, we have the Healthier Black Elders research pool where older people age 55 plus can actually participate in research, get a feel for it, and then maybe decide if they want to collaborate further. And so with that, I hope that you walk away from this knowing a little bit more about the ways that older adults can get involved in research and why it matters. And with that, I will take questions.
Can you go back to that slide with Healthier Black Elders? I wanted to put that phone number in our chat before I start asking questions.
Okay.
Let's see.
Yeah, I think we have about 1,500 or so older adults that participate in the pool. And so usually they ask screening questions, and then depending on what studies are available, people get contacted for all types of studies. And it's really become a resource. It was originally designed for researchers at the 3 research universities in Michigan, but we've had people from all over the country use this participant pool. So it's really been sort of a valuable asset for researchers, but also a way for older people to engage in research and learn about research too. My mom is a very active participant. She's done probably every study she could possibly do.
I think, you know what, that is particularly important when we're thinking about engaging, you know, in research and involving seniors in research. And we do have a question, and go ahead, Dr. Bell, if you wanted to take yourself off of mute and answer your question.
Well, good evening, Dr. Britton and Dr. Sneed. As I dropped in the chat, I am in the car. I was overbooked this evening. Dr. Sneed, it was an excellent presentation and eye-opening on so many levels. And I have so many thoughts swirling. One is, yes, we're going to have to figure out a different term or a different viewpoint, because as a 56-year-old woman, no, I do not consider myself a quote older adult, end quote. So we're gonna have to figure that out. But the need is so very great. As I'm thinking about just personal experience over the last maybe 10 days, I have known of a 57-year-old man and a 60-year-old man to literally drop dead, and no one really knows why. And I know those things happened. I can remember it happening, unfortunately, a couple of times in early 40. And I know, and these were all, most of them were Black men. And so I know there is a lot of necessary research to try to answer some of those questions. The work with Alzheimer's is especially close to home, having dealt with that with my mother for 9 years and buried her just over 8 years ago. And I know how crucial that is. So I'm just kind of swirling with ways to get the message out. You did such a great job of explaining when you were talking about the collaboration with the community. I likened it to how over 30-year K-12 educator, and I likened it to ways that we try to engage support in that arena. So I think you do a great job of making it very clear and very plain, the need, and going to really be working hard to continue to get that message out.
Yeah, no, I think you're exactly right on so many levels of things that you mentioned. A lot of the work, and I've started to, I think that's why I've even moved more toward midlife and a lot of the work that I do, and starting to collect information long before people turn 65, because by then things are already in motion, you know, so if we can figure out how experiences earlier in life impact longevity and impact quality of life when you get older. We're even seeing, you can look at experiences people have had when they were children and how that impacts their risk of dementia. You know, so we really sort of try to take a life course perspective, recognizing that there's lots of opportunities to intervene much earlier.
I agree.
Yeah, so your point is very well taken. Absolutely.
Thank you.
One of the questions that I had, because you were speaking my love language. I love community engaged research, and my research portfolio included research that was really informed by my work at Karmanos in the community in looking at disparities in colorectal cancer screening, as well as the reasons that I heard from the community why they weren't going to get screened. And so leaning into that. One of the things that was really, maybe you can help us understand, how can a person who's interested in research as a participant figure out whether or not, you gave some examples of what is community engaged research, but how would somebody know it when they see it, right? Because to your point, they come in and they got the flyer and things like that. What might be a question a potential participant might ask of a researcher to really see if it's community engaged research? Is there certain red flags people need to look out for if they don't want to participate in research that they don't feel is community engaged?
I say, look at who's doing the talking. You know, like when I'm doing work, especially when I'm in the field, I'm not the person doing the talking. I'm in the background looking to see how things are going and troubleshooting if possible, but I'm not leading the work. The real sign of something being community engaged is that community members are actively participating in the process. You know, so if you don't see that happening, it's probably not a community engaged research project. I mean, I can recognize that community engagement can happen at lots of different points in the project, but a really good sign is, are the people around you, are they all PhDs? Are they all MDs? Or are community members really the ones doing the talking and doing the work? To me, that's the biggest way to identify if it's community engaged work.
So when you're thinking, and so the Flint women study was so interesting to me because in my mind, it dispelled a lot of myths about what folks in mid and later on in life are interested in doing with the time they have on their hands. To your point, as you said in your presentation, they didn't want to sit and play cards at the senior center. They are vital, important folks with a perspective that they want to share. And what are some of the projects that are coming up to address, in particular, the exchange of information between new moms and seasoned moms and things like that? That was really interesting to me.
So we're in the process of planning a study like that right now, where we actually train older women in the community to provide postpartum support to younger women in the community. And so right now we're sort of in our information gathering phase to try to figure out, what do new moms need? What does the whole family need? You know, because I think a lot of the research is really focused on the new mom, but how can we support partners? How can we support other people in the home? And kind of design an intervention that recognizes the skills that older women in the community already have, but that also sort of augments those skills as well. And so we're in the process of putting something together like that. So part of why we gather the information is to find out, what do older people want to do? You know, because it surprised me that people wanted to spend their, just like you described it, it surprised me that people wanted to spend their time giving back in that way. You know, and I think about, you know, I think my own mother, and that's not particularly her desire per se, you know, but, you know, over and over, I think we saw that older women saw that women in the community were struggling. And they're like, I have something to offer. I may not have money to leave people in the community, but, you know, I have resources, I have wisdom, I have experience, and I want to share that back. And so, you know, we're very much in the process of developing programming like that, where people can provide support to young moms, thinking about for older people who want to provide support to children, which was less popular in the interviews that we did, but really trying to think about how to develop a program and what would that look like. And so taking pieces from existing programs. So, you know, we started talking to people, mention programs by name that they heard about in other cities that they were interested in. So I know like Detroit has the WIN, I think it's called the WIN program that's focused on postpartum support. There's one in Grand Rapids called Moms Bloom. And so we started talking to those folks about how they got their program started and, you know, how can we do something like that in Flint? So very much thinking about how can we take what we learn and actually put into action.
So I'm going to throw you a loop because one of the things that how I connected to you is really your work among older adults that are formerly incarcerated and working on those issues. Can you talk a little bit about your research and some of the things that you know or you can share about some of the data and I don't know, just really kind of talk about that because that is something that we don't talk a lot about. And it really is important. I mean, Michigan is getting older. And we really need to focus on folks that are formerly incarcerated.
Yeah. Incarceration has definitely become a gerontology issue in a way that it hasn't before. And so I work with a number of folks that are really trying to put greater emphasis on the fact that when we talk about aging, we have to talk about incarceration. If you look at the data from the Bureau of Justice Statistics, you'll see that the number of adults over the age of 55 has increased almost 300% in the last 2 decades. And so a lot of that is due to sort of the minimum sentencing laws and the ways in which they change. So that, if you got sentenced to 20 years at minimum, you have to serve that. That's the law in Michigan. And so as a result, there are a lot of people who are aging in the criminal justice system. And the system was not designed for older people. If you think about, if you go into a prison, and there's some units that literally just look like nursing homes. And they're not designed, the physical structure of them is not designed to support older people. So people have a lot of physical health problems, and the prisons are just not designed to cope with that. When people get out, where do they go? Nursing homes don't want to take people who've been incarcerated. There's a lot of demand for nursing homes, and so they can be picky about who they take. So if you have a history of criminal justice system involvement, especially if it's for something violent, you have a hard time finding a place to live. You have a hard time getting into long-term care. You have a hard time getting a job. And so that impacts your health and well-being in a lot of ways. And we haven't really thought about that in the context of older people. But as the cohort of people who went into prison in the 90s for various reasons, as they age, is going to continue to be a problem. And so a lot of the work that I've been doing with that group really focuses on thinking about what can we do to support people in reentry. You think about a fact that a person who's been incarcerated for 20 years, they're not going to have much Social Security when they get out, because they probably don't have a long work history. And my community partner who does a lot of this work, he says, that's one of the things that surprised him the most, is that people thought that they would have, because they were older, that they would have Social Security and things like that. And it's like, how do I go out and find a job when I'm 65 and the only job I can get because of my criminal history is something that requires physical labor? And so really kind of trying to think about those issues, both from a health perspective. So thinking about people a person who's 40, for example, has the body of a 55-year-old if they've been incarcerated, because there's kind of this accelerated aging process that happens. So thinking about ways to support people in reentry who may have chronic health conditions and helping them to kind of manage those better and kind of understand them better is a lot of my goal. And sort of a broader, I also think even more broadly, we're talking about helping older people transition, both in terms of their health, but also the broader issue of employment and having a place to live, and their overall well-being is a lot of the work that I do as well.
Now, you mentioned, can you tell us a little bit more about the Institute of Gerontology at Wayne State? Can you give us a little information about that?
Sure. So the Institute's been around since the 1960s. Originally, there was one Institute of Gerontology that was joint between Wayne State and U of M. And so for logistic reasons, the Institute split into two. So U of M still has their Institute of Gerontology as well. And so we do a lot of work. All of the faculty there do research on older adults in varying capacities. So we have a lot of researchers who do more of the cognitive neuroscience piece. And so they're trying to look at sort of the neural correlates of dementia and identify the reasons why certain groups develop dementia. So we have a fair number of researchers who do that. And then there's also a fair number of us who do kind of the social behavioral research as well. So we have folks with backgrounds in psychology and social work and anthropology. It's an interdisciplinary unit, which I really love, because we all sort of look at the same problem from a different perspective. So as researchers, we all have appointments in the Institute of Gerontology, and then also in whatever department at the university that reflects our academic background as well. In addition, the Institute of Gerontology does a lot of engagement and outreach. That's actually what drew me to the Institute, I think, more than anything else. I think about the number of older people that participate in programming, and it's amazing. The older adults that are involved in the Institute put on a big conference every year, an Issues on Aging conference. I think this is going to be the first year that they have it in person since the pandemic, but they plan it. And whatever topics they're interested in, it draws lots and lots of people. And so the Institute's a really great place to do research and to connect with older people and kind of think about the research needs of older people. And so I really love it for that. We also do a lot of work to educate health professionals as well. So particularly health professionals who may not have a focus on older adults, and kind of telling them a little bit about how to work with older adults in a better way. But we do all types of professional development for social workers. They can earn continuing education units. I give talks on all kinds of things, whether it's bias or sort of community engagement as well, and how agencies can actually engage with the people that they serve better. And so I really love the Institute for the education we provide. We also have a pre-doctoral program as well. So if there are PhD students who want to get advanced training in aging, the Institute does that as well. So research, education, outreach is our bread and butter.
Wow. One of the last questions I want to ask you, being mindful of your time, is why aging? What made you decide, given your extensive background and being able to kind of do really anything, what was it that drew you to aging research?
Initially, I think I grew up in a multi-generational home. So my grandparents lived with us most of our adult life. I grew up in a very religious home, so I was always around older people. I can't remember a time when I was in a room that there weren't older people, and I just really value older people and the contributions that they make to society. I think, in particular in American culture, you don't see that value the way you see in other countries, which is really a shame. And so helping older people to live longer, healthier lives has always been important to me. Just because, those are the people that I just always naturally gravitated to, even starting with my grandparents at a young age. My mom jokes that I like to do research just so that I can study her. That's not the reason. That she's my guinea pig. She is, but that's not the reason I do the work. Really, I just value older people and the contributions that they have to offer. And so it was just sort of a natural thing for me as a result.
That's a beautiful thing. One of the things that, among other things that I'm going to take away, is as DREF Research Matters for All of Us continues to work to engage on our community engagement strategy, the videos of that might be played and how to engage our midlife and older adults that are part of our volunteer cohort for the DREF Research Matters for All of Us. Oh, that's a great idea, in terms of 30-second videos that might just say, hey, I'm a part of all of us, and this is what I've gotten out of it so far, and this, that, and the other. I'm like, that's a great idea. I mean, because most of the time we're thinking about, the church health fairs or other ways, but there are multiple ways to begin to think about engaging older adults in research, and not just through the usual ways. And I appreciate it on your slide, though, the multiple ways that you have talked about how to engage community in research. So I really appreciate that. I don't have any other questions. I don't see any other questions in the chat, but I really appreciate your time this evening. We do focus on topics in general, but really focusing in on aging is of particular importance. Like you said, the aging of the population, and the fact that with the All of Us Research program, I don't know. I have to take a look at how many people have signed up thus far. It'd be interesting to go into the researcher's workbench, and they do have some front-facing things that the public can see in terms of looking at the age stratification of those that are engaged in the research, right? So that's something I'm gonna put on my task list to look into. But again, thank you so much. Definitely looking forward to hearing more about your upcoming studies and how to share that information with possible potential participants and things like that. So we'll definitely stay in touch. And with that, I am going to end our live event on Facebook. Thank you all on Facebook for joining us. See you next time on Facebook.